My name is Chen and I'm from Imperial College London. I'd like to show you some of our recent work on using clinical CT data to identify the degree of cerebral small vessel disease. Aging is the natural process of becoming older. It's often associated with physical and cognitive impairment. As a byproduct of aging, small vessel disease can develop in the brain. The cerebral small vessel disease is often associated with other diseases like stroke. It develops step by step even in normal aging. The red arrow points out it in the mild form. However, if more moderate or severe forms of small vessel disease develop, the chance of diseases like stroke significantly increases. Therefore, it's important to identify moderate and severe small vessel disease. Much of the current work focuses on biological and clinical aspects of small vessel disease, and there is not much work that aims to identify it automatically. To the best of our knowledge, this is the first automatic approach detecting small vessel disease. In the first step, we construct an atlas to localize regions that are likely to contain brain areas with small vessel disease. For this, we collect 277 FLAIR images with small vessel disease. Lesions are then manually delineated. All MR images are registered to a template afterwards. An atlas is then constructed based on the registered lesions. Finally, the atlas is mapped to each of our 590 CT images. After this step, we obtain a patient-specific probabilistic map of likely locations of small vessel disease. We extract the patches from the region of interest for each CT image. However, the number of patches differs between subjects. To address this, we associate every subject with a bag. In the next step, we are going to build a bag-level classifier to identify brains with moderate or severe small vessel disease. In the training stage, our multiple instance learning algorithm learns several weak discriminative patches. In the testing stage, the final result will be based on an ensemble of the suggestions given by these patches. The parameters of the weak classifiers are learned by solving an optimization problem. We use every weak classifier's FM to classify each bag BI and compare the result with the reference. After assessing all bags, an error is computed. By minimizing the error, the weak discriminative patch PM and other parameters are learned. The weak classifiers FM are actually the distance between the patch PM and the bag BI. The distance between a patch and a bag is computed as the weighted sum of the Euclidean distances. As there is no previous study on a similar task, we compare the performance of our method with some other common algorithms. One is thresholding on the T-score map. It's widely used in clinical practice. We calculate T-score maps for all CT images and carefully select a threshold to get the abnormal errors. Then the volumes of the regions are used to identify brains with moderate or severe small vessel disease. The other approach is based on random forest, which is one of the most popular machine learning algorithms. In this case, we assess two features including the voxels in the whole brain and only those located in the regions of interest. The approach based on T-score maps performs poorly, while the random forest approach is better, but is still worse than the proposed approach. More importantly, the proposed method has a performance which is comparable to the inter-rater consistency, that's around 75%. In this paper, we tackled a challenging clinical problem, namely the automatic detection of the degree of small vessel disease. We developed a multiple instance learning framework based on large CT clinical datasets. The results are very encouraging, suggesting further clinical evaluation. In the future, we intend to segment and quantify the small vessel disease and predict outcomes of the diseases further. Thank you for your attention.